Hi everyone. We have a little bit of a different setup. I don't even know if you guys can really tell. What I'm seeing in front of me is very different. I'm in actually our sister lab today. So luckily they still have a whiteboard. There was a little bit of a scheduling issue, but no worries. So all we really need is a whiteboard, right? So we're good. I'm having to kind of finagle things a little differently, but it's totally fine. So today we are starting the second section of this course, the skeletal section, right? So the first section was all about evolution and those conceptual ideas, and now we're moving into the second section of this course, which is the skeletal system. So today, this particular recording is going to be pretty short. Just as the name implies, it's a very short introduction to some of the terminology, few of the skeletal system functions, but some basic stuff just so we can then jump into the next few, which will actually be probably a bit longer, where I'm actually going to be showing you a lot of bones and stuff. So the fun part is that in the lab, it's a lot more hands-on, but the lecture, because I want to make sure you're getting all the info, those ones might be a smidge longer than the typical ones we've had lately. I'm going to try to still keep them short. I know because you can pause them, but even though I've shortened the bone list of things that you have to know because it's the summer, there's still an extensive list that we have to go through. So we'll kind of see what happens when we get to that. But anyway, for today, we're doing the Intro to Human Skeleton PowerPoint. Once again, you can have me side by side. You can follow along in whatever way you like to. You can have me just in your ear while you are watching the PowerPoint on your computer. It's really up to you. I trust you guys to figure out how you want to do that, how it works best for you. So the first slide, osteometry. So this is basically measuring the bones. Now you can see in the image, there's a picture of what we call calipers. Those are spreading calipers. So sometimes when you have, let's say, an object like the skull, where it's round, you can't really take a ruler to this, right? If you want to get some measurements like, this point to over here, you can't just take a ruler. So we'd use those spreading calipers to be able to kind of pinch that and still be able to get the measurements, right? We also have smaller ones that are called sliding calipers, where you can get into the intricate details of the eye orbit or the nasal opening, because they're really small and pointy, so you can use those. So that allows you to kind of take a complex shaped item and be able to take measurements from it. And we'll do a little bit of that in the class too. A lot of things you can tell by looking at the body, either by measurements and or by some visual methods. So the first thing, age. Age, you can tell by looking at multiple locations in the body. Probably the best place is looking at the teeth. Our teeth erupt at a very particular rate, and so if you find the remains of someone where not all of the adult teeth are in yet, you can estimate their age fairly precisely, versus once someone's a little bit older, you can look at other areas of the body, but the age ranges tend to be a little bit more wider. For example, if you still have baby teeth and some are erupting, some new adult teeth are coming in, then you could tell someone's age within a couple of months. But let's say someone's 30 and you're looking at all the markers in the body, you might be able to tell, oh, this person's between 30 and 40. So the age range does get a little wider, but all of that information is still very useful in a forensics case, for example. The next thing, sex. So we will be spending time in this class going over sex determination. So this is how, when you look at either the pelvis or the skull, those are the best areas. You can determine if you're looking at a male or a female. And we're actually going to spend a big portion of a couple lectures ahead of this one. We'll talk about that. We're going to have some pelvies. We're going to have some fun time in the lab with that as well. But you can absolutely tell that using some very particular visual methods. The next thing, let's see, go through the list. Stature, so height, so determining someone's height. If you just had the femur, that's probably the best bone to have. So that is the bone in your upper part of your leg or your thigh, the femur. If you have the femur, you can determine someone's height fairly precisely. You can still use the other bones of the leg, like the tibia or the fibula, or even the bones of the arms, because we have a very particular ratio of how, our arms to our legs. So you could use a bone in the arm, like the humerus, for example. Your margin of error might just be a little more, but you can still get pretty close. And if all you have is a humerus, right? If you don't have a femur, then you use that. And then let's see, health. You can, whether it's a disease process, an injury, you can determine a lot of that by just having the skeletal material. Now, obviously, if you had soft tissue, you can tell a lot more. But there are plenty of diseases or injuries that will affect bone either directly or indirectly. So sometimes even just having the bone can still give you a lot of information about a particular individual or like a population. So next slide, where it says the human skeleton. So some of this I'm assuming is a little bit intuitive to you or a little bit logical, that for example, the first bullet point, that the skeletal system is set up to protect the body and support the body. So basically, there are certain areas of your skeletal system that will protect organs. So like think of like your ribs protecting your lungs and your heart, your pelvis protecting some of the reproductive organs. But this whole skeletal system in itself serves as like the foundation, like the structure underneath your entire body, right? And then everything kind of attaches to that, the muscles, etc. And so that's kind of the building blocks, like the foundation for your entire body. Also, blood cell formation occurs in the bones. And you may have heard of this, thinking of like bone marrow and stuff like that. Or like the marrow cavity, where this happens. And then also, bone and cartilage are both part of the skeletal system. The skeletal system is not just bone, it is both cartilage and bone, because we have a lot of areas of our body that is still cartilage, and this is still considered part of the skeletal system. So obviously we have some cartilage in our face. We also have cartilage in like our spine, a little bit in the pelvis. I already said face, right? Like the nose, stuff like that. So we have it kind of throughout the body, and it's still considered part of that entire system. Next slide, joints. So moving on to joints. Now, typically when you hear the word joint, well, in the context of the skeletal system, right? We think of like a joint like this, like my elbow, right? It's a very freely movable joint, but that's only one type of joint. There are actually three types of joints. So the first one, as you can see here, number one, is called a fibrous joint. Fibrous joint is an immovable joint. They don't move. Now you might be thinking, wait, I thought the whole point of a joint is that that's where there's movement, right? But a joint actually is just the articulation of two bones connecting to each other. One bone connects to another bone, that's called a joint. It doesn't always mean that it's movable. That's just kind of because we use the word joint typically to reference the movable ones, but a joint actually is just simply when one bone articulates or connects with another bone. So this first type are immovable joints, fibrous joints. And a really good example, as shown in the image, and I can kind of show you here, is in the skull. Your skull is not just one big skull bone. Please don't write that on the exam. I have students I'll be like, name this bone. They're like, the skull, right? There's names for all of the different bones. We'll get into that later. But you can see here, like these lines, let's see if I can get the glare off. You can kind of see the lines, right? So we call those suture lines. That's basically where one bone is connected to another bone. And you can't like move the bones of your head. That's not how that works. So they are not movable, but they are still considered a joint because they're a connection between one bone and another bone. Go to the next slide, you'll see the other two types. So the second type is called cartilaginous. So just talking about cartilage a moment ago, cartilaginous bones, that is where two bones connect to each other via some cartilage. So the vertebrae in your back are a really good example of this, where you've got, one vertebrae and then a little bit of cartilage and then like the next one. The ribs, so you have your sternum right here, the sternal region, and the ribs connect to it, but for many of them they connect via like long pieces of cartilage and or sometimes short pieces of cartilage. But that cartilage allows for when you're breathing in and out, there's a little bit of give and take with that. And the cartilage in the spine allows you can kind of move your spine. You can't move it like an elbow, but you have some movement. And you'll see here that these are called slightly movable joints. The third type is called a synovial joint, and so this is usually what people think of when they think of a joint in terms of the skeletal system. So like your elbow, your knee, shoulder, the ones that are really, really movable. And they're called synovial joints because of the fluid that's in that area, that joint area. It's called synovial fluid. And so usually someone in class, just by chance, it typically happens, someone's popping their knuckles at around this time. And I'll tell you, that is actually, people will tell, I gotta pop mine now. People will say, oh, don't pop your knuckles, it's really bad. That's not true. Obviously, if you're bending your fingers back so far, you're gonna tear something, don't do that, right? But the popping is just the synovial fluid. Basically, there's just a little bit of gas pressure in there, and when you pop your knuckle, you're just distributing that synovial fluid. You're kind of breaking up the gas bubbles. And so it's actually really good for you to do that. It alleviates a lot of the pressure, right? We're always trying to find ways to like crack our back and stuff. I always ask my boyfriend, can you pop my back? And he's always really scared. So I feel like I need to get someone to pop my back soon, you know. But we all do like our neck and stuff, this is, no wonder it feels good, right? You're distributing those gas bubbles. And so it's not harmful to you. Like I said, I knew one person who was always like trying to crack their thumb, but in this really aggressive way. Like that's obviously going to be a problem. So, probably don't do that. But yeah, so those are the 3 types. Moving on to where it says bone type. Am I blowing my nose off camera? That wind is, I don't know when you were watching this, but, well, really the wind the last few weeks has been kind of crazy. Anyway, bone type. So there are 2 listed here, compact and cancellous, and or cortical or trabecular. Sorry for all the extra terms, like I didn't name them, right, So you can use either term, it doesn't really matter to me. The main thing is that you understand the difference. So when you're looking at a bone, you can see here where it's kind of shown, it's kind of sliced the bone in half and then it's zoomed in. So you're seeing the outer, thicker, dense bone on the outside. That's the cortical or compact bone. It's very dense, right? But then that internal structure of the bone is a lot more porous, and that is the cancellous or trabecular bone. Basically, it's set up to be, and a good comparison is, think of cardboard. If you ever looked at a piece of cardboard, you can see it's like dense on the outside, but in like the inner workings, you see it's a lot more porous. It's the same idea, that there needs to be an outer structure that's dense and protective, can provide structure, and then the inner part is a little more lightweight, so it can be strong, but yet lightweight at the same time. If our bones were compact the entire way through, our bones would be so heavy, we wouldn't be able to move them, right? So those 2 types. If for some reason, I'd have to look into the textbook, the lab book, because it's kind of a newer version. Sometimes textbooks will incorrectly use the term spongy bone. Never call it spongy bone. That is a complete misnomer and makes it sound as if it's absorbent, and that's not at all what's happening. It's porous. That's it. So if for some reason another instructor calls it spongy bone, tell them that's wrong. It's absolutely wrong. So if you ever come across that term, just know, complete misnomer. Don't use that. Moving on to the next slide where it says long bone sections. So you can see here, this is like a general bone, right? And it's kind of showing you those 3 areas. We have like the shaft of the bone, or the diaphysis, kind of that long middle part. Then you have at the end the epiphysis, where it's usually kind of more bulbousy in some way. And then basically you have the metaphysis, which connects those 2 together. The reason we kind of differentiate these is because in development, let's say fetal development and or right after birth, a lot of the bones are not like one bone. They're still in sections, and they're usually kind of forming via these sections kind of connecting together. And so we reference them because in development they actually are separate. And usually in adulthood, when you're looking at one of these bones, you can see the lines of where these connections are made. Moving on to everyone's favorite terminology. Now there's a long list here, and these are just the ones I could think of the ones I probably will mention in class. There are probably a few more. Don't feel the need to sit with this list and try to memorize it all. I would look at it a few times and just maybe have it as a reference for when I mention some of these in class. Every time there's a different feature on a bone, it gets its own name, right? If it's an area where a muscle is attaching, if it's a little groove or a line, they almost all have their own little names. And so we have very particular ways that we call them depending on if it's like a hollowed area or a pointy part. We make sure that some of the names, there's a little bit of similarity with how we name them. So just kind of going through a couple of these on this list. The first one, process. So this is where there's a projection of some sort off of the bone. We call it a process. Going down, you can see there's one called a condyle, and usually that's when it's kind of projecting a little bit, but it usually tends to be rounded and smooth. So there are kind of rules to when you would use like process versus tubercle versus condyle, right? Condyle usually is when another bone's going to connect with it. And these would just be terms you would learn if you took, future osteology courses. They will get in your brain a little bit more. But just, like I said, go through this list a couple times. Just, don't stress about having to memorize each and every term. But just know I will be using these later. Going down to the last two, we've got fossa and foramen. So a foramen is a hole. Whenever there's like a hole in the skeleton somewhere, it's going to be called something foramen or foramen something, right? So as just an example off the top of my head, in the skull, we've got like the foramen magnum, foramen rotundum, foramen ovale, right? So they all have foramen somewhere in the name, but they all have a different part of the name to reference, oh, this is this hole or this hole or this hole. And then fossa, as you can see in the image, it's pointing to, this is actually the humerus. Whenever there's like a hollowed out or depression, it can be kind of shallow, it can be kind of deep, but this is always called a fossa. Next slide. So the sections of the skeletal system, we've got the axial versus the appendicular. So the axial skeleton is basically like this middle part, like your chest, your thorax area, your spine, your head, right? And then the appendicular skeleton, appendicular like appendages to your arms and your legs, and also the bones that connect your arms and your legs to your axial skeleton. So think of like the bones of the arm, that's your appendicular, but your clavicle and scapula, or like your shoulder blade, those are not part of the arm, but they connect your arm to the axial skeleton. So those are still part of the appendicular, system. So you can kind of see the color difference between that lighter kind of pink purple and then like kind of bluish plum color, where the two are different. The next slide, directional terminology. These will absolutely be terms that I use quite a bit, so I would make myself familiar with these next 3 slides are definitely terms I would say, because there's only a few on each slide. I would definitely take the time to maybe kind of memorize these ones a little bit if you can. So directional terminology, basically whenever we're referencing a direction with the body or the skeleton, we use something called, the first thing is we use something called anatomical position. So you can see here in this image, this is what anatomical position is. And so it's an individual, feet are together, arms are kind of out like this. I want to make sure you guys can see it's palms up. It's always palms up. The reason it's palms up and not palms down like this is because the two bones in your arm, this part, when you have palms down, they actually crisscross over each other, and when it's palms up, they're parallel to each other. So we say palms up because if you were, let's say, viewing, the whole point of this is anatomical position, is you're viewing the skeleton in its like entirety. So having the two bones parallel where you can see them clearly is the most efficient way. So it's always palms up. Like I said, I'm not this high, I'm just showing you my hand, right? But you can see on the image on the PowerPoint, that's the perfect example of anatomical position. So whenever we reference something, it's in reference to this position. And when we say, because we don't say, left or right typically, we can sometimes, but we typically try to use other terms, but even if we did, it's always that individual's left or right, never you, the person observing. So the next slide, some planes of view where you might like separate. So the first one is sagittal. So this is dividing the body into like a left side and a right side. The next one is coronal. So this is dividing the body into a front and a back. And then transverse, kind of cutting you in half this way. So, top and bottom. And we have very technical terms for this, right? We would say, instead of front and back, we would say anterior and posterior. So actually, if you go to the next slide, I have a list of these terms. Oops. Yes. So going through this list of, looks like there's like 5. The first one, superior versus inferior, and I have kind of more of the common term next to it, above or below. So if something's kind of on up here, we would say it's superior. If it's down below, we'd say inferior. And we'd use these terms to compare like 2 areas. So I could say my head is superior to my knees. That makes sense? Or my feet are inferior to my skull. So we use them in that sense. The next one, anterior versus posterior. Like I mentioned just a moment ago, anterior is towards the front. Posterior is towards the back. So I could say like, oh, my sternum is anterior to my spine, or my spine is posterior to my sternum. The next one, medial lateral. So imagine you have a line dividing your body into left and right halves. If it's towards that line, that's medial. If it's away from the line, it's lateral. And so if you're always in anatomical position, which is, like this, you could say, oh, my thumb is lateral to my pinky, right? Or my pinky is, medial to my thumb. Or in anatomical position, you could say, my sternum is medial to my elbow, something like that, right? The next one, proximal and distal. Proximal and distal you only use on the arms and the legs. Be very careful with this one. You only use it on the arms and the legs. And this is a reference to how close on the limb are you to the main trunk of the body. Are you really close to the main trunk of the body? That's proximal. Are you further away from the main trunk of the body? Then it's distal. So I could say my hand is distal to my elbow, right? It's further away from the main trunk of my body. Or I could say my elbow is proximal to my wrist. Hopefully that makes sense, right? Now, let's say we're talking about the legs, you would use proximal and distal. You're not going to use superior and inferior. You would never say my knees are superior to my feet, even though you're thinking, well, that kind of makes sense. It's because on the limbs, we don't use those terms. We use proximal versus distal. So instead of saying my knees are superior to my feet, we would say my knees are proximal to my feet. Now, if one of the other regions is not on the leg, but one of them is, then you can use superior and inferior. So you could say, if you're referencing one feature on the leg, let's say like your ankle, and the other one is not, let's say my nose, I could use superior, inferior. So my nose is superior to my ankle, right? Hopefully that makes sense. And then the last one, which more when you're dealing with soft tissue, we'd use this one, but it's superficial or deep. So we could say like, is it external or like internal, right, of the entire body. So you could say my skin is superficial to my lungs, or my heart is deep to my skin, right? So those are kind of coming in pairs. I'm going to use those a lot, anterior, posterior, lateral. So I would say, at least with this last slide, make sure you kind of know these terms pretty well. I know, like I said, we're cramming this all in. We're probably going to talk about it for just a couple of days, but these will be important, probably more so than some of the other terms. Okay, just around 20 minutes, perfect. And this is just the little introductory one. So yeah, I'll see you guys on the next one.